A very good morning to one and all. Hearty welcome to all the participants. Our webinar is based on diabetes and COVID-19, clinical considerations and dietary recommendations. Before beginning the session, let me remind few things. Please make sure to mute your microphone and camera till the end of the presentation. Never click the present now button on the screen at any point. You can raise your questions in the chat box. After each session, an interactive session will be provided and you can clarify your doubts. The link to the feedback form will be posted in the chat box at the end of the webinar. All participants who attend the webinar will receive the e-certificate only on submission of the feedback form. Now, without further ado, let's begin the program with a silent prayer. Now I invite Dr. Sister Selen Matthews C., Head of the Department of Home Science, for the welcome address.
Hello everyone, good morning, good afternoon, good evening, whatever which your time zone was. And welcome to today's webinar on COVID-19 and diabetes. First of all, I thank you all for taking time out and being here today. November 14th is observed as World Diabetes Day. This year, World Diabetes Day falls during a global pandemic. It has already taken the lives of many people. According to the World Health Organization, 6% of the world's population has diabetes. India is known to be the diabetes capital of the world. Diabetes Day and this webinar is meant to raise awareness about causes, complications, living with diabetes, and tips for prevention. In connection with World Diabetes Day, Department of Home Science, in collaboration with IQAC of Nirmalagiri College, Kuthuparamba, Kannur, hosting the international webinar that will serve to amplify the message that diabetes can be controlled and highlight the importance of timely diagnosis, treatment, and self-care. On behalf of the Department of Home Science, it is my pleasure to invite all of the dignitaries, academicians, young researchers, and students from all over the world to attend the international webinar. Once again, I thank you, all of you, for finding time to spend with us during this pandemic. Now, let me get into my proud privilege that is to welcome you all to this webinar. We have two excellent experienced speakers today, Dr. Nasir Ali and Ms. Ashwati Biju. Dr. Nasir Ali is a senior consultant endocrinologist working in Maitra Hospital, Calicut, Kerala. He did his MBBS and MD in General Medicine from Calicut Government Medical College and DM in Endocrinology from All India Institute of Medical Science, New Delhi. He also worked in many prestigious hospitals in Kerala. In this webinar, our expertise endocrinologist Dr. Nasir Ali will provide updated knowledge and evidence-based information on how COVID-19 has impacted people living with diabetes across the globe and will share best practices to improve diabetes care during this difficult time. We would love to hear from you, sir. Your presence makes us happy. I extend a cheerful welcome, you dear sir. We are pleased to welcome Ms. Ashwati Biju, a very special guest from Qatar. She is a chief dietitian working with Hamad Medical Corporation at the Cuban Hospital. She also worked as a chief dietitian in prestigious hospitals in Muscat, Oman, and Kerala for many years. She did her post-graduation in clinical nutrition from Sri Ramachandra Medical University, Chennai. Ms. Ashwati Biju is an experienced dietitian, will be sharing with us her expert opinion as a dietitian to the continuous care needed for the diabetes. Wholeheartedly, we welcome you, ma'am. I am delighted to welcome our respected principal, Dr. Ausepichan KV, Nirmalagiri College, who is always encourage us with his continuous support in all our venture. I proudly welcome you, sir.
Thank you.
Next, I would like to welcome our accuracy coordinator, Dr. Sabu Sebastian, and all the colleagues for today's section. I would also like to congratulate and welcome the organizers of the webinar, Dr. Jessie Varghese, Deepthi Lisbeth, Manu KM, and Roshin Thomas for their continuous effort, otherwise not possible to conduct webinar like this. And I would like to extend a gracious welcome to all the participants. I hope the webinar will be meaningful, thought-provoking, and fruitful for all of us. Stay safe. I wish you all a very successful webinar. Thank you.
Thank you, sister, for your beautiful words. Let me invite Dr. Ausepichan KV, Principal, Nirmalagiri College, for the inaugural address.
Respected resource persons, Dr. Nasir Ali, Ms. Ashwati Biju, IQC Coordinator Dr. Sabu Sebastian, my fellow teachers, colleagues, and dear participants. Every crisis is an opportunity. COVID is a crisis. It has caused many problems. Diabetic patients are most adversely affected by COVID. Death rate of diabetic patients affected by COVID is very high compared to other diseases. Diabetic is a lifestyle disease, and a proper understanding of the causes of diabetics and proper dieting will help one control diabetics. The webinar being conducted today will help us understand both sides of the problem. Dr. Nasir Ali, an eminent resource person, will throw light on problems caused by COVID for a diabetic patient. Ms. Ashwati Biju, an expert dietitian, can help us understand the food habit to be followed by diabetic patients. That's why I said in the beginning that it is an opportunity as well. I take this opportunity to sincerely thank Dr. Nasir Ali and Ms. Ashwati Biju for joining us, for throwing light on these issues. On behalf of Nirmalagiri College, I extend a warm welcome to them once again. I congratulate the Department of Com Science headed by Dr. Sister Selin Matthew for organizing an international seminar on a very relevant topic. I congratulate everyone who has been instrumental in organizing the webinar. I also wish all the participants the very best. Wishing you the very best. I conclude my words. Thank you.
Thank you so much, sir, for your supporting and inspiring words. Let's move on to the technical sessions. The first technical session, led by Dr. Nasir Ali, a senior consultant endocrinologist, Maitra Hospital, Calicut. I hand over the session to Dr. Nasir Ali. Sir, please.
Good morning, all. I hope I am audible and visible to all of you.
Yes, sir.
Okay. At the outset, I thank the Department of Home Science, Nirmalagiri College, for inviting me for this session. And I thank the chairperson for the nice words. Coming to the topic, diabetes and COVID-19 clinical considerations. So we are going through the pandemic phase now, and actually we live surrounded by a lot of microbes around us. This includes bacteria, viruses, fungi, mycobacterium, etc. And we do not develop disease because of our innate and adaptive immunity, which prevent us from getting infections and diseases. But at some times, some diseases affect us, like diabetes mellitus, HIV, some other conditions, some treatment of some other conditions like immunosuppression for a transplant. Such diseases can actually suppress our immunity and make us more predisposed to develop infections. Microbes often infect us and produce some sporadic infections. They can infect us, a few people, and that can go off. Sometimes this can spread to a larger area. We call this as epidemic. And sometimes that can, microbial infection can spread over a much larger area, even beyond the continents. We call them large pandemics. Coronaviruses are not rare. Actually, all of us have been infected with coronaviruses at some point of time. And most of the upper respiratory tract infection we often develop is produced by coronaviruses. So most of the immunocompetent people, when infected with coronaviruses, that usually goes off as a mild upper respiratory infection. But in the history, we have had severe coronavirus infections and epidemics and even pandemics, which killed hundreds of people. The first one such event was the SARS epidemic, which happened in 2002, which started from China, that affected around 8,000 people and killed about 10% of the people whom it infected. That was the coronavirus. Then exactly 10 years later, MERS, Middle East Respiratory Syndrome virus outbreak happened from the Middle East, Jordan, and Saudi Arabia, that affected around 2,000 people and killed almost 37% of the infected people. And the latest one in severe coronavirus infections is the present novel coronavirus, that is SARS coronavirus 2, which caused COVID-19, the present pandemic, which was started in December 2019 in China. So the pandemic so far. On March 11th of 2020, COVID-19 was declared a pandemic by the World Health Organization. As of 22nd of November, that is last week, over 5 crore people have been affected by the disease on record, and 1.3 million have already happened globally. Globally, the highest percentage of cases, infections have been reported in the 25, that's the young adult and adulthood, and in the youths. But if you look at the percentage of death, 75% of deaths occurred in those aged 65 years and above. So this graph shows the different WHO regions and the progress of pandemic. Actually, the colors shows different WHO regions, and you can see the first, second, and third waves of the pandemic. And the black plot is that of death, plotted as a weekly number of death and cases. So regarding some basic points about the COVID-19, the average incubation period, that is once you get this infection, on an average 5 days. At 5 days, you will present symptoms. And this can range from 2 days to 14 days after infection. And 98% of those who develop of those who are infected will develop symptoms within 11 days. So by 14 days, if you do not develop symptoms, probably it's over. The incubation period is over, and you may not develop symptoms afterwards. 80% of the people who are infected will be asymptomatic or mildly symptomatic in the form of mild upper respiratory infection, throat pain, mild fever, etc. And usual symptoms are cough, nasal congestion, shortness of breath. Some can develop sore throat, fever, and body ache. indigestion and diarrhea are other symptoms. And loss of smell and taste is very characteristic of the present day COVID-19 infection. Most death occurred in more than 60-year-olds and in those with pre-existing condition. But otherwise, normal young people have also been affected and succumbed to death of COVID-19. Now, my agenda for today's talk is one, to introduce diabetes mellitus to this heterogeneous crowd. Then to discuss regarding the diabetes and susceptibility to viral epidemics in diabetic patients. Then diabetes and COVID-19 pandemic, risk of infection, severity and mortality in diabetic patients. Then diabetes treatment in COVID-19 patients, preventive measures and conclusions. So introduction to diabetes mellitus. What is diabetes? Diabetes is a chronic metabolic disease which is characterized by high blood glucose levels. We all know that high blood glucose levels is the diagnostic criteria, is the characterization of diabetes. Normal fasting blood sugar is less than 110, and American Diabetic Association considers this as less than 100. And 110 to 125 is qualified as pre-diabetes. That is, you are not yet qualified to diagnose a diabetic, but you are on the way to develop diabetes. And if it is 126 or more, then it qualifies for the diagnosis of diabetes. Then postprandial blood glucose, normal should be below 140. 140 to 199 is qualifies for a diagnosis of pre-diabetes, and 200 or more qualifies for a diagnosis of diabetes. HbA1c or glycated hemoglobin. Previously, this was used to only to monitor glycemic control in diabetic patients. Now it is also used to diagnose diabetes. Less than 5.7 or sometimes considered as 6 is considered normal. 5.7 to 6.4 or 6 to 6.4 is considered as pre-diabetes, and 6.5 and above is considered as diabetes. So any of these values which qualifies for diabetes in 2 occasions, you can make confidently the diagnosis of diabetes. Why should we treat diabetes? Because diabetes can cause acute and chronic complications. Sometimes you may wonder because people are there running around with sugars of a borderline like 200, 190, 210, 240, 220. They are totally asymptomatic. Then why should I take medicines? Why should I do exercise? Why should I try to bring the sugars down? This is because you are at risk of acute or chronic complications of diabetes. Acute complications when sugars sometimes can go very high, and high blood sugar sometimes can lead to severe critical conditions like hyperosmolar state or diabetic ketoacidosis. And that is acute complications. You have to prevent this, and this can also be triggered by infections, septicemia, etc. Then chronic complications, this actually happen very slowly. So you may be having a mild diabetes, but over years, even that mild elevation of blood sugars is enough to cause serious damage to heart, blood vessels, eyes, kidneys, and nerves. Chronic complications, we classify these into 2. That is microvascular complications and macrovascular complications. Microvascular complications, there are major 3 microvascular complications: retinopathy, nephropathy, and neuropathy. About 1 in 3 people with diabetes who are older than age of 40 already have some signs of diabetic retinopathy. Finding and treating diabetic retinopathy early can reduce the risk of blindness by 95%. About 25% of people with diabetes eventually develop diabetic kidney disease, and this is the major cause of renal failure, dialysis, and renal transplantation, especially in diabetic patients. Neuropathy may affect up to 50% of people with diabetes over long term, and this can lead to loss of sensation in your feet, your hands, ulceration in your feet, and that can even lead to amputation of your limbs. Then macrovascular complications leading to cardiovascular mortality, heart attacks, strokes, and vascular occlusion of the limbs, etc. So these are the chronic complications and there are acute complications. In order to prevent these complications, you need to bring your sugars down to near normal. And studies have shown that bringing sugars down to near normal or treating your diabetes with all the modalities like dietary changes, exercises, weight reduction, tablets, insulin, or whatever is used, and bringing your glycated hemoglobin down to below 7 will reduce your chances of developing retinopathy, kidney disease, heart disease, and neuropathy, everything by at least 50%. So can we prevent diabetes mellitus and diabetic complications? So you have seen that you can prevent diabetes complications by treating diabetes well and controlling your sugars well. But can you prevent diabetes mellitus itself? Yes. Actually, we have two major types of diabetes. There are many types of diabetes, and the most common type of diabetes is the type 2 diabetes. Almost 90% of our diabetic people are suffering from type 2 diabetes. That is primarily a lifestyle disease. And actually, type 2 diabetes occurs in those who are genetically predisposed, like you have family members with type 2 diabetes. And yes, in such people, when their weight increases, when their activities is less, when their diet is not taken care of, then these environmental conditions lead to development of diabetes in those who are genetically predisposed. So if you are genetically predisposed, or if you are even otherwise not predisposed to diabetes genetically, if you can observe a good lifestyle, you can prevent or at least delay occurrence of type 2 diabetes to some extent. Actually, in this context, I would like to discuss the diabetes prevention program, which was a study done in the United States of America. Actually, they took few patients with pre-diabetes. Pre-diabetes we have already discussed, that is, they are not normal, but they have not reached the diabetic stage. So in between, borderline diabetes. They took pre-diabetic patients and they divided these patients into three. And one group was given some drugs. One group was just left as they were going on. And the third group, actually, they advised some lifestyle and dietary changes. Actually, the lifestyle changes advised were some dietary modifications to reduce the calorie intake, to reduce the refined sugars, etc. Dr. Ms. Ashwati may elaborate on this. Then exercise. The exercise advised by them was 150 minutes a week of brisk walking. That comes to 30 minutes a day for 5 days a week. So, and weight reduction of 5 to 7%. Actually, what they showed from this study was that pre-diabetes patients converting to diabetes was prevented by 55% only with diabetes, only these lifestyle measures, weight reduction, regular exercise, and diet. And this 55% reduction was seen in 3 to 4 years of duration of this study. So coming to the diabetes situation around the world and its importance in infectious diseases. Actually, about 422 million people worldwide, that's around 8.6%, have diabetes. In India, a recent study published in Lancet 2018 showed about 7.7% of adults are diabetic. The same study shows the data for Kerala as 10.5%. And majority of diabetic patients reside in low and middle income countries. Prevalence increased with increasing age till 65 to 70 years of age. Then 1.6 million deaths each year directly is attributable to diabetes. And another thing is both the number of cases and prevalence have been steadily increasing over the past decade. We have discussed about the type 2 diabetes, which contribute to 90% of diabetes. The type 2 diabetes prevalence is steadily increasing, probably because of the urbanization, because of the sedentary lifestyle, is steadily increasing. At the same time, type 1 diabetes is not related to lifestyle anyway, and it is purely because of the pancreas failure to produce more insulins. And this also is increasing steadily. The type 1 diabetes, which contribute less than 10% of diabetes, but it is more difficult disease in terms of insulin usage. Actually, you have to use insulin in all type 1 diabetic patients, and usually present in teenage years, and it can present in any age, but usually in teenage years or even in children. So type 1 diabetes is not essentially a lifestyle disease. That is also increasing in prevalence, and that probably is contributed by the endocrine disruptors, our pesticide use or plastics or whatever. We don't know. So this graph one shows that with age, the prevalence of diabetes, type 2 diabetes increases. The second graph actually that shows the sad fact that many of our diabetic patients, especially in the rural areas and in low and middle income countries, they do not know that they have diabetes, and they do not get proper treatment also. Now, diabetes and susceptibility to viral infections in diabetes. Diabetes patients have clear-cut immune deficiency. It's a well-known fact that diabetic patients have immune deficiency. Diabetes is known to confer increased risk of infections. And there are studies which have shown that HbA1c, glycated hemoglobin, which indicates the last 3 months blood sugar levels, that if HbA1c is high, your risk of getting admitted to hospital for some infections in general, and especially infections of the respiratory tract in particular, is more. So poor the glycemic control, your risk of getting infections, and especially respiratory tract infection, is high. And an increased risk of infection was reported during previous outbreaks of severe acute respiratory syndrome, middle-aged respiratory syndrome, and H1N1 influenza virus. So we have discussed the SARS, MERS, etc., previous coronavirus outbreaks. Then H1N1 influenza virus, frequently every 10 years, pandemic occurs. So all these pandemics, diabetic patients were shown to be at higher risk of getting infection, and also higher risk of getting severe disease if they get infected. So what about the COVID-19 pandemic, risk of infection, severity, and mortality in diabetic patients? Actually, there are few studies. In China, they looked at a large number of COVID-19 affected patients, and they looked at the prevalence of diabetes in those patients. They found that out of all those COVID-19 patients, only 8.2% were diabetic. And this 8.2 is similar to the prevalence of diabetes in general population of China, that is 8 to 10%. That means there is no preferential infection of diabetic patients. That is, diabetic patients were not more infected, more at risk of infection because of their diabetes. And similarly, in a study from Italy, they looked at the diabetes prevalence in those who were admitted with COVID-19 in an hospital at an age of around 65 years, and that was 8.9%. And there, at the same age group, general population, diabetes prevalence was around 11%. Again, this also shows that even though diabetes increases the risk of infection in general, most studies have reported prevalence of diabetes almost similar to that in general population in patients with COVID-19. So that means diabetic patients are not at higher risk of, may not be at higher risk of developing COVID-19 infection. So what's the problem? The problem is when you look at the severity, if you are a diabetic patient and if you are infected with COVID-19, then the severity of COVID-19 in diabetic patients. Patients with COVID-19 with diabetes were more likely to require admission to an ICU or to die. So severity is more in diabetic patients. If you get infection, you may not be at high risk of getting infection, but once you get infection, your chances of getting admitted to an hospital, your chances of requiring oxygen, your chances of requiring non-invasive ventilation or even ventilator support, or your chances of dying of the infection is slightly increased in diabetic patients compared to non-diabetic patients. The prevalence of diabetes in a study from UK, actually, we have seen that in all the COVID-19 patients, diabetic patients contributed only around 10%. But if you look at the severe COVID-19 patients, diabetic patients are there to the extent of 35%. And another study from British COVID-19 hospital, it was found that your chances of dying of COVID-19 was 2.3 times more if you have uncontrolled blood sugars compared to non-diabetic people. So from these studies, you can infer that you may not be at increased risk of developing infection, but if you get infection, if you're a diabetic, your chances of developing more severe disease, your chances of developing requirement for ICU admission, death, and severe complications is more. So risk of infection is similar in diabetic patients and non-diabetic patients. Risk of developing severe disease, ICU admissions, and death increased in diabetic patients. So what could be the causes of increased severity in diabetic patients? One, we have already said, diabetes is an immune compromised state. So once they're infected, your body's ability to deal with the infection and its complications may not be as good as non-diabetic people. And another thing, diabetes is a prothrombotic state. That is, in diabetes, there is a tendency for the blood to clot more. So in COVID-19, one of the causes of death is small clots forming inside the lung vessels. So in diabetes, probably that is leading to increased clot formation in the lung, maybe. Another thing is diabetes is a pro-inflammatory state. So your chances of developing cytokine storms, which is a complication of COVID-19, which could lead to death and severe disease, may be more in diabetic patients. Still, another thing is that associated comorbidities. So diabetic patients usually have, especially type 2 diabetic patients, usually have associated heart disease, respiratory disease, kidney disease. Many of them are on dialysis. They have end-stage renal disease. Probably many of them must have undergone a renal transplantation for kidney failure. So all these comorbidities can lead to severe disease. Another thing is obesity. Obesity is also an association of type 2 diabetes. Obesity is already found to be contributing to see a bad outcome in COVID-19. So age, obesity, renal disease, heart disease, etc. are contributors of severe disease in diabetic patients and even in non-diabetic patients when they are infected with COVID-19. So what to do? Yeah, you should be more vigilant, and these are the vulnerable group of patients: diabetic, old age, those with renal disease, kidney disease, heart disease, respiratory disease, very obese people. So reverse quarantine of vulnerable is also important. And another interesting thing is that any comorbidities, if you get infection, actually your chance of survival is more than chances of death with adequate treatment. But availability of timely medical care is crucial in many of these patients. Sometimes you may survive only with some oxygen, with some small support, some drugs like steroids, etc. But in the situation of present-day pandemic, where the virus spreads very rapidly, affecting thousands of people every day, large number of patients in a short span of time will lead to disaster. This is because all your hospital capacities, even private, government, or whatever, can be overwhelmed within days. And symptomatic patients who do not get admission to an hospital, who do not get ICU support because of unavailability, who could have been otherwise treated and saved, may die. So that's the problem when in the situation of such a rapidly spreading infection. So even if you are young, non-diabetic, otherwise healthy, you have to take care of yourself. You should not get infection and you should not spread this infection, because you should be contributing to death of many other people, even if you are safe. And another interesting data is coming nowadays. There are few reports of new onset diabetes following COVID-19. Actually, COVID-19 or any other viral infection can trigger other immune-mediated diseases. And COVID-19 is already shown to trigger some neurological diseases like GBS, Guillain-Barré syndrome. And now they have seen some reports of diabetes triggered by COVID-19. So we don't know what type of diabetes is this. Is it like a type 1 diabetes who will require lifelong insulin treatment, or some other type? We do not know. Sometimes this diabetes may resolve by itself. We do not know. So there is an international collaboration. COVID registry is formed so that these numbers are very less. So we can, from all over the globe, you can collect these cases so that can be analyzed to study this further in a detailed way. So in the future, we'll be getting more data on such interesting occurrences. Now, treating diabetes in COVID-19 patients, dealing with coronavirus infection in diabetic patients. So most often, even if you are a diabetic, most often your disease is going to be asymptomatic or mildly symptomatic. So you need to check your blood sugars more frequently, because during any infection, even with viral infection, even if you are mildly symptomatic, your sugars can go out of control. So if you have the glucometer with you, it's better if you check your sugars more frequently. And if you are asymptomatic or mildly symptomatic, you have to continue your medications for diabetes or your other ailments like heart disease, hypertension, cholesterol, your kidney disease. All those regular medications need to be continued. You should not discontinue any of these. And if you record high blood sugars, like more than 250 consistently, then you may check for ketosis. This is especially true if you are a insulin treated patient, or if you are a type 1 diabetic patient. And you have to check your sugars, repeatedly check your sugars, and if it remains high, check for ketosis. Ketosis can be checked from the urine. You have urosticks sticks available, and you can check it from the blood also, just like glucometer. You can check ketones as well nowadays. And if your sugars are very high consistently, and if you are a type 1 diabetic on insulin, you can add take extra dose of insulin, like 10% of your dose can be added. If ketones are present, if blood sugars remains high persistently, then you have to get medical help. You have to contact by phone or similar methods to your doctor, your hospital or clinic or whatever. And in any situation, if you are infected, you have to keep yourself adequately hydrated. This is especially true if you are a diabetic, because dehydration is one which precipitates many acute diabetic complications. So most asymptomatic patients and mildly symptomatic patients should continue their regular medicines for diabetes, hypertension, heart disease, and kidney disease, etc. And in COVID patients, you can have reduced appetite, loose stools, and sometimes vomiting. So in such situations, you are at risk of low blood sugars. So if you have the facilities, you can check your sugars more frequently to look for risk of low blood sugars. And if you are not able to eat well, then even you can drink kanji waters, you can drink even fruit juices, etc. So even if you are diabetic, in such situations, you have to take such measures. Then severe disease requiring hospitalization usually will need insulin initiation and to control sugars, because in severe disease, sugars definitely will go very high because of the stress and sepsis, and many treatment, very effective treatment like steroids in COVID actually lead to very high blood glucose levels. Now, dealing with coronavirus infection in diabetic patients. So when sick with a viral infection, we have already discussed, people with diabetes do face an increased risk of diabetic ketoacidosis. This happens especially in type 1 diabetic patients. Type 1 diabetic patients are insulin deficient. So when there is insulin deficiency, you are at risk of increased catabolism. So fatty acid catabolism lead to production of ketone bodies. And very high ketone bodies in such situations can lead to diabetic ketoacidosis. When this happens, what happens is but the symptoms are dehydration, dizziness, then abdominal pain. Sometimes they start vomiting, and then in the later stages, they start breathing very fast. So these are the features of diabetic ketoacidosis. So this happens in type 1 diabetic patients. So if there are any signs like indicating diabetic ketoacidosis, it is an acute emergency. You have to take the baby or the person to an hospital. DKA can make it challenging to manage your fluid intake and electrolyte levels, which is very important in managing sepsis. If your blood sugars are registered high, greater than 240 milligrams, more than 2 times in a row, check for ketones to avoid diabetic ketoacidosis. So in type 1 diabetic patients with coronavirus infection, never stop your insulin. Even if you are not eating well, take some fruit juices or whatever you like and continue your insulin. You can adjust your insulin dose according to the sugar monitoring. So you have to do more frequent blood sugar testing. Extra doses of insulin can be taken for high blood sugars. Check ketones if blood sugars consistently high. Contact hospital, doctor, diabetes specialist, nurse if positive ketones, if vomiting, if feeling dizzy, etc. Small frequent foods, more fluids would help in such situations. Now, how to prevent? We have already discussed about preventing diabetes with lifestyle measures alone. So what are the measures to prevent COVID-19? So one, how to deal with restrictions. So different part of the globe is going through different phases of the pandemic. Many areas are seeing a third or fourth wave of the pandemic. Many areas, actually, the pandemic is getting abated. Many areas are entering the restrictions. Many areas actually are going away from restrictions, relieving restrictions. So if you are in an area where there is restrictions being applied because of intense spread, if you are a diabetic or any other chronic disease person, keep 2 to 3 weeks supply of medicines always with you, including insulin tablets. This is not because the supplies are not going out of stock, but this will help you not to miss medicines during the restriction period. One. Second, this will help you not to go out frequently to buy medicines during the intense spread of the infection. Avoid unnecessary travels, including to the hospitals or clinics. If you feel you can delay your visit to a doctor, you can do that if intense spread of the infection is going on. Consider online consultations, etc. if available. Many hospitals have started doing this. Keep contact number of your clinic, hospital, or treating doctor handy. Also keep a number of trusted person, neighbor handy for emergency, especially if you are an old age person or a couple living alone. Always keep contact number of a clinic or hospital or your treating doctor, and also a trusted person in the neighborhood for any emergencies. And have healthy diet, regular exercise, and regular medications. This is very important because we have seen a surge of patients getting out of control in their blood sugars because only following the restrictions during the lockdown. Actually, people have been regularly walking, doing exercise, playing football or badminton, going to swimming pool or going to gyms, etc. before, and many such people had very good glycemic control previously. Following the lockdown and closure of gyms, swimming pools, then sports, stopping the walking outside, then swimming, all the exercises, they just started sitting inside home watching TV, and there was no other exercise to replace their previous activity, and that led to high blood sugars, high BP, weight gain, etc. This can prove disastrous in coming few years, because many of such people who had been well controlled in terms of their diabetes and hypertension have gone out of control. So even if you are sitting indoors, you have to do some regular exercise, like you can do some aerobics, you can walk in the premises, you can climb up and down the stairs, etc. So you have to do some exercise, and that will help you to remain physically fit, and also in such situations, your mental well-being will also be helped by a regular exercise. And regular exercise, a timed exercise, especially, can also help you to keep an order on the time and command over the time. Now, how to prevent COVID-19 infection? It's the same for all diabetic and non-diabetic people. And no doubt, the most important is using a mask. What we have understood till now is that mask is the most important thing to prevent this infection from catching you. And then avoiding crowded places. Unnecessary crowds should be avoided. Social distancing. Frequent hand washing with soap and water. Sanitizers. Reduce unnecessary travels, including to hospital visits during the intense spread of infection. So, to conclude, prevalence of diabetes mellitus, both type 1 and type 2, is increasing globally. Type 2 diabetes is mostly preventable with good lifestyle measures, diet, exercise, weight loss, etc. Diabetes leads to immune dysfunction and increased susceptibility to infections. Diabetic patients may not be at higher risk of getting COVID-19 infection, but once infected, are more likely to develop severe disease and complications. COVID-19 disease is found to trigger many diseases, especially neurologic and autoimmune diseases, and among them diabetes mellitus in some patients. Good blood sugar control with appropriate medicines combined with a healthy diet and regular exercise is the key in successful management of these patients. Obesity, hypertension, heart and kidney disease, which are often present in diabetic patients, also worsens outcome. So care of these comorbidities is also very important. So thank you for your patient listening. Thank you.
Thank you, sir. Now it's the time for interaction. If anybody have any queries, either you can post it in the chat box or you can unmute and ask. So there is one question. Is this possible for a diabetic person to change from insulin to tablets?
Yes, actually, that depends on what type of diabetes it was. If the person was a type 1 diabetic, which always require insulin, then that's not possible. Then sometimes we give insulin to type 2 diabetic patients when during some conditions, like if some infections, some surgery, pregnancy, these conditions sometimes require insulin. In that case, if they were very well controlled with tablets, then for that time for some complication, we shifted them to insulin. Then once that condition is over, you can go back to tablets. There is no problem. But sometimes, especially in previous years, what we used to do was people who are not controlled with OHA. That is, all sorts of tablets have been tried. Sugars are not under control. And then we call it a secondary OHA failure, a secondary oral hypoglycemic agent failure. In such situation, if you go to insulin, definitely we cannot go back to the tablets which have been proved ineffective in such patients. So there is no such law that once you started insulin, you can't go to tablets. You can go to tablet provided if the tablets were effective before, that will be effective afterwards. But another condition is that over 20 years or even more, with time, actually, insulin reserve can go down. So all type 2 patients, many type 2 patients, diabetes patients can develop insulin deficiency later on. In such conditions, again, they will behave like type 1 diabetes. That is, they will require insulin for good glycemic control.
So one more question in the chat box. Sir, earlier doctors instructed that patients should take insulin after breakfast. Now it is changed to before breakfast. I understand that it is because patients often forget to take insulin after breakfast. But I suspect that this will permanently damage your pancreas because it is not all functioning if we give insulin earlier. What is your opinion?
No, it is not like that. Actually, that depends on the action profile of the insulin. If you are using human regular insulin, that has to be used 20 to 30 minutes before food, be it breakfast, lunch, or dinner, wherever it is prescribed, that has to be taken 20 to 30 minutes before. That is the action profile. By that time, the insulin starts acting. Your meal will also reach your glucose will also reach the bloodstream. And if you are using analogs, you can use analog insulins just 5 to 10 minutes before meals. You cannot take any insulin after meals, especially the bolus insulins. There are other insulins which is usually taken at bedtime or like that. That's not the case. So insulin, you have two types of insulins: basal insulins, bolus insulins. This basal insulin actually covers your fasting blood sugar. That is not dependent on the meals. Bolus insulin, if you are using that has to be before meals. And how long before meals, that depends on what type of bolus insulin. We have human insulins and analog insulins, and there are few new insulins have come up in the market, actually, like Fias. So such insulins can be used immediately after meals also, because they act very rapidly. So it is not like insulin damaging your pancreas. Actually, insulin supports your pancreas. We have found in All India Institute, my colleague, actually, Dr. Bhattacharya, did a study in type 2 diabetic patients. They initiated insulin for all type 2 diabetic patients as part of the study, and found that with insulin, their pancreas recovered to make insulin by themselves. And many of these patients went into remission. That is, they could stop all the treatment for some time, but later on they will again develop diabetes. So insulin will support your pancreas. It will never damage your pancreas. And bolus insulins has to be taken before meals, and some bolus insulins, which are newer analogs, can be taken after meals, but immediately after meals. But ideally, all these bolus insulins has to be taken before meals.
Okay, thank you, sir. One more question is there. Sir, how far we can control diabetes on a strict meal plan? That means age is a barrier for this without taking medicines.
Actually, the question itself answers. Actually, a strict meal plan, how far we can control diabetes. So the question is, how far you can continue a strict meal plan. If you could control your sugars with a strict meal plan, you may be able to control sugars for a longer period, as far as you can stick to your strict meal plan. So that's not always the case. So if stricter the meal plan, the higher the chances of default from the meal plan. So more near the regular, if actually Ashwati may be a better person to answer this. So I'm not a person who recommend a very strict meal plan, because that you can recommend if you are maybe 100 kilograms weight and 120 kilograms. So to see a rapid loss of weight as an initial therapy for very short duration, you can do that, but this cannot be continued. That's the problem with strict meal plans.
Okay, thank you, sir. Two more questions. Do I need to worry about diabetic ketoacidosis?
Yes, actually, if you are a type 1 diabetic who is on insulin, you have to worry about. If you miss your insulin doses, you can develop diabetic ketoacidosis. And even in type 2 diabetic patients who are on insulin or who have major infection, cardiac disease, stroke, etc., you can develop type 2 diabetes. So this is a common complication of type 1 diabetes who develop some severe infections or who miss insulins.
Okay, thank you, sir. One more question. Is a varicose vein problem dangerous for diabetic patients? Is any treatment for that?
Varicose vein problem per se is not associated with diabetes, but both of these can cause problems in your foot, because diabetes can cause neuropathy, then arterial disease, and along with that, varicose vein can also produce ulcers. So both of these can act complementarily to worsen your health of your feet. Varicose vein has many treatment, yes, and you have to meet vascular surgeons for that, or even general surgeons.
Okay, sir. How diabetes is related with heredity? Is it possible to cure diabetes permanently?
Actually, yeah, curing diabetes permanently, as of now, no. Actually, diabetes, I consider it as a tendency. So if you are 100 kilograms weight, and if you could, and you just become diabetic, if you could bring down your weight to 60 or 70, then surely your diabetes will go off. And if you can maintain your weight at 60 or 70 for next 10 or 20 years, sometimes your diabetes may not come back again. At the same time, if you go back to your previous 100 kilograms, your diabetes will come back. So there is no cure because that tendency is there. Then heredity. Of course, type 2 diabetes is usually genetically predisposed. You can see that in households, many members are affected with type 2 diabetes. Even if you are not very obese, you have type 2 diabetes. And other households, you will see in your neighborhood that many obese people, none of them have type 2 diabetes. So there is hereditary predisposition to type 2 diabetes. And type 1 diabetes is mostly HLA related. So you may not find a lot of type 1 diabetes patients in same house, but there will be a lot of type 2 diabetes in household. Thank you.
Sir, can I ask a question? Actually, it was a new knowledge for me that by reducing the weight, you can bring down diabetes during type 2 diabetes identification itself.
Yeah,
so,
actually, you can induce remission of diabetes in some people. The conditions are if you are recently diagnosed to have diabetes, type 2 diabetes, and if you can bring about significant change in lifestyle, like if you have been eating a lot of calories, carbohydrates, and if you are obese, and if you are very sedentary, and you can change all these bad health habits to good health habits, like reducing your calories, bringing down your weight, increasing your physical activity, then your diabetes can remit. We call it remission. It will go off for some time, but that usually already you develop diabetes means you have that tendency to develop diabetes. And whenever these good habits go off, whenever you put up more weight, this diabetes will come back. And age is another factor. Even if you do all these measures, you are predisposed to develop diabetes. So by age itself, the diabetes can come back. And another thing which I wanted to stress is, even if you have a remitted diabetes, so you reduce weight, you now start a regular exercise, you are on a healthy diet, and your diabetes went off, and you were able to reduce or stop your medicines. In that case, you have to be aware that your diabetes will come back at some point of time. So you should not be in a false belief that your diabetes is gone forever. So you have to check your diabetes frequently. Otherwise, this will deceive you, because you may not check your sugars. Sugars will come back, and that will remain borderline high, and that can also lead to chronic complications. So even if you have a remitted diabetes, you have to check your sugars periodically, along with other comorbidities like cholesterol, hypertension, etc.
Thank you, sir. Actually, it happened with my brother, so it was a very good information for me. And now it is remitted in his case. So we were thinking that it may be a machine error to show the diabetic thing, and we are not having our parents. No one is having diabetic, in the family history.
Now,
but he has sedentary life.
So as far as he continue his good lifestyle changes, he may be able to keep diabetes away for some time, but mostly that will come again in the future. So he has to be mindful, and he has to check your sugars frequently.
Okay, sir. Thank you.
Sir, two more questions. Sir, is diabetes a problem for healing wounds? And one more, glucometer can give wrong reading. Any suggestions for that?
Actually, the diabetes and healing, there is a false notion that the other way around. That is, people tell you that I don't have diabetes, or my diabetes is under control because my wounds are healing well. That can happen even if your sugars are high. But generally, high blood sugars can impair healing. But normal healing of wounds do not indicate that you do not have diabetes or your sugars is under control. To say that your sugars are under control, you have to check your sugars. What was the next question?
Sir, glucometer can give wrong reading. Any suggestion for that?
No, actually, nowadays the glucometers are enough for our diabetes monitoring. There can be 5% variability. So that is advisable. You can use glucometer, especially if you are using insulin, because multiple doses of insulin requires multiple blood sugar checks a day for best control. So it is not possible without a glucometer. So it's better you use a glucometer, especially if you are in a remote area and if you are on insulin. It's better you use a glucometer, and that's reliable, good enough for our day-to-day adjustment of the insulin dose and all.
Okay, thank you so much, sir. I think questions are over. I think let's move on to the next session. Before that, a word of gratitude. Dr. Nasir Ali discussed well about the different respiratory diseases, especially COVID-19, and he explained the complications of COVID-19, particularly people with diabetes, and how to manage the situation. So the session was very intellectual, very informative and interesting. Thank you so much, sir, for sharing your precious time with us. Thank you so much, sir.
Thank you.
Let's move on to the next second technical session, that is led by Ms. Ashwati Biju, dietitian, the Cuban Hospital, Hamad Medical Corporation, Qatar. I hand over the session to Ms. Ashwati Biju. Ma'am, please.
Hello, good morning to all. Am I audible?
Yes, ma'am. You are audible. Yeah.
Okay. Okay. First of all, I would like to express my sincere gratitude to all the people who has organized this function. The principal, the sister, Ms. Deepthi of Nirmalagiri College, and I would like to thank my colleague, Ms. Shafina, who has referred me to Ms. Deepthi. So, wishing you all a very nice day. Hope you will enjoy the session. Okay, we will start the session. Are my slides visible?
No.
Dr. Tashodi?
Is it visible now?
Yes, yes. No, it's okay.
Okay. Okay. So we will be dealing with diabetes and COVID-19 recommendations today, dietary recommendation mainly. I will be discussing certain things about COVID and diabetes. Okay, so first we will see what exactly is meant by health. Like we all need a healthy body, healthy mind, and healthy spirit, right? So our father of our nation has told that the health is the real wealth, and rather than pieces of gold and silver, if we are healthy with a good mind, body, then that's the most important thing. And even the World Health Organization has referred to health as like a state of complete physical, mental, and social well-being rather than the absence of disease or infirmity. Okay, so now the pandemic has got over the whole world. Like coronavirus pandemic has got over the whole world, so it has affected the health in various ways. So we all are locked in, and everyone are having a difficult time. So we will see what exactly how the COVID-19 is affecting our body. So it mainly affects the respiratory system. The COVID-19 disease, this is a severe acute respiratory syndrome. So this is mainly affecting the lungs, the respiratory tract of our body. So the the place where the gaseous exchange happens is the alveoli of our lungs, right? So there is a fluid accumulation inside the alveoli, which like makes us feel difficulty in the breathing, and that is what is causing the difficulty. So the virus, it is like going and affecting the alveoli. So it like makes the fluid secretion, and that is the reason why which in the serious conditions the people develop breathing difficulty, and like that is the real effect of COVID-19, how we are getting affected. Like the gaseous exchange is getting affected as well. So this is the basic condition. So the main symptoms seen in COVID patients are like fever, chest pain, chills, rapid heartbeat, breathing difficulty. Severe cases lead to pneumonia, kidney failure. Okay, and mild symptoms may be headache, sore throat, cough, shortness of breath. So when we have these symptoms, we like think, oh, we need to go for a checkup. So we need to take a lot of measures to prevent the spread, mainly via coughing and sneezing. So as doctor mentioned earlier, wearing a mask and covering our cough and avoiding crowds is the main important thing what we need to do. So mainly this affects our immune system. Like are secreted from different parts of our body, which is as shown in the picture, the lymph nodes, the appendix, the bone marrow, the Peyer's patches in the intestine, spleen, thymus, tonsils. All these organs help in providing the immunoglobulins, which give us the more immunity in our body. So we will think in the other side, like with the COVID-19, the whole world is locked down, and the environment is healing itself actually. When the humans are suffering a bit, but then a lot when we see it. So now this COVID-19 lifestyle has changed all our lives. Like most of us, majority of us were working from home. Then there are more online activities. Most people spend time watching movies, watching shows, shopping online. All these were the like new norm who were comfortably sitting at home. So the new normal has become a statement nowadays. So what is the new normal? Like it keeps us away from the being vulnerable, like reducing vulnerability by keeping a healthy lifestyle, reducing the virus transmission by observing infection control measures, reducing contact with the potential disease carrier, reducing the duration of the infection by establishing effective disease management mechanisms, and also ensuring governance and accountability by putting in place strong health regulations and policies. Our governments in all the countries, they have given us policies to follow. So all of us as citizens and responsible people, we need to follow the regulations and guidelines provided to us. So I work in Qatar, so here the government has strict policies. So most of them need to be at home. Then even if we are going out, we need to maintain social distancing, 2 meters at least. And always we need to make sure to wash our hands with soap and water and disinfect ourselves wherever, if we go out or even at home or at work, we need to keep doing this in between. So now diabetes, COVID-19 and nutrition. About diabetes, Dr. Nasser has explained in detail. It was a great eye-opener and a very informative session. So most of you have understood what exactly diabetes is and how COVID-19 has affected diabetic patients. So now we will see how through diet and nutrition, how can we manage diabetes. So like always, we have been hearing a lot of stuff about nutrition, like one must eat to live, not live to eat. So basically our body, we need to take care of it. Every time we eat or drink, we are either feeding a disease or fighting it. So we should take the opportunity when we eat. It should be to nourish our body. Okay, so the doctor of the future will no longer treat the human frame with drugs, but rather will cure with prevent disease with nutrition. That Thomas Alva Edison has said many years back, and during this COVID situation, we find it true. When the diet is wrong, medicine is of no use, and the diet is correct, then medicine is of no need. That's an ancient Ayurvedic proverb. Like all this, like sounds true in this condition now. So good nutrition will prevent 95% of all diseases. So now nutrition advice for adults during COVID-19. Adults or any age, we need to follow these regulations. We need to eat a well-balanced diet every day to get the essential nutrients, vitamins, minerals, dietary fiber, proteins, antioxidants, which makes our system healthier and stronger immune system, and lower our risk for chronic illnesses and infectious diseases. So how we will plan our diet? Like all of you are nutrition students, so you will be familiar with many of the pictures or many of the things what I am telling. So if in case you need any clarifications, you can ask me later. So this is the healthy plate which we usually need to follow, like the grains, proteins, vegetables, fruits, dairy. All these food groups should be included in the desired quantities. And if you see the plate, like usually we Keralites, we tend to eat lots of grains, and the vegetables sections will be very poor usually. Protein, fruits. That is like every meal we may not have all these things included, but we should take care that especially when we advise to patients, we need to make sure that they have a balanced plate in each meal. So each food group has their own importance. The vegetables, the fruits, the grains, the protein, the dairy, each of them have their own roles, and they have provide necessary nutrients. Especially for diabetic patients, we need to take care. So today, more than 95% of the chronic diseases is caused by food choices, toxic food ingredients, nutritional deficiencies, lack of physical exercise, because all of us are in a fast mode life. So preparing or taking care of the meals what we are taking in are often like very much different from the previous days. So now the healthy eating pyramid, most of you will be familiar with this too. So this keeps changing, like our nutrition field and medical field, it is a ever updating field. So like according to each period of our life, we need to keep changing, updating according to our activity level. So before, like if we see the base of the pyramid was full of like rice, starchy foods, and then that we used to use lots in our food. Then moderation of proteins, then less of fats, like that. But look at the new pyramid. It's like the base is full of fresh fruits and vegetables. The green has gone up, and the milk and protein has gone again up, and the healthy fats are on top. So we need to balance our diet with all these fresh produce. God has blessed us with a lot of variety of foods in the nature. So we need to choose wisely. So now coming to diabetes. There are different types of diabetes, as doctor mentioned before. There is type 1, type 2, gestational, and other forms of diabetes which are developing due to certain specific conditions. So for the type 1 diabetic patients, as doctor mentioned, they need a supply of insulin every day because their body doesn't make enough insulin. And in type 2 diabetic patients, there is insulin, but it is not enough, or it is not working properly in our body. And for gestational diabetes during pregnancy, some of the patients, they develop a high blood sugar. And when we are on some treatment for steroids or in certain conditions like cystic fibrosis, we tend to have a higher blood sugar. So now coming to the nutrition therapy, the dietary recommendations. What all are the main things what we need to concentrate on? We need to choose the foods which improves the glycemic control of the patient. Okay, and then it should slow down the progression of diabetic complications. As doctor mentioned before, there are different diabetic complications which affects the other organs of our body, like cardiac problem, nephrotic problem, neuro problem, retinal problem. So all these complications we need to delay. Like if the patient is diagnosed to be a diabetic, we need to try to keep his blood sugar under control and prevent him to get the complications. So the macronutrient intakes, what we need to take care is like the percentage of kilocalorie distribution depends on the food preferences and metabolic factors. So can anyone give me in the chat box, like how would you recommend the carbohydrate, protein and fat breakup? Are you aware of that? Okay, I will tell you. Like usual recommendation, what we suggest for our patients is like around the total calories. If we break up into like carbohydrates will be around 60 to 65% of the total calories recommended for the patient. And the proteins and fat can be 15 to 20% of the total calorie depending upon the patient's condition. Like if they already have a renal problem or any cardiac issues, we will be differentiating the protein and fat accordingly. So we need to maintain a consistent day-to-day carbohydrate intake unless using intensive insulin therapy. Like if the patient is on insulin therapy, we need to keep a strict vigilance on the patient's diet so that he will not go into hypo or hyperglycemia. So for the total carbohydrate intake, based on the metabolic needs, types of insulin or other medications and individual preferences. So that all these depend on the carbohydrate quantity. So it will be based on the metabolic needs of the patient, the type of insulin what they are using, and other medications, and the individual preferences of the patient. Then the recommended sources for the carbohydrate is preferably mostly from non-starchy vegetables, fruits, whole grains, legumes, and milk products. All our foods contain quite a quantity of all these nutrients, so we need to plan accordingly. Glycemic index is another factor which we need to take into consideration. That is important. Choosing low or high glycemic index foods may be modestly improve the glycemic control. So whenever we plan a menu for a diabetic patient, we should be choosing foods which have lower glycemic index. I hope you know what is glycemic index. It is the value given to each food. Like when we intake that food, how fast the blood sugar is released to the bloodstream after digestion. That is the glycemic index of each food. So, like for example, if we are going to take sweets, it will be having a very high glycemic index. or for whole grains, it will be a lower glycemic index. So we need to choose low glycemic index for diabetic patients. And as far as sugars are concerned, minimize added sugars, like we can avoid white sugar and other sugar substitutes. Sugary foods they are counted as the carbohydrate allowances. Fructose as an added sweetener is not advised, like extra fructose. We can include fruits in the diet, but other supplements or other added additives not recommended. Artificial sweeteners can be used safely, but in our practice, we don't actually recommend artificial sweeteners unless and until the patient really requests for it, because the health concerns or the exact side effects of artificial sweeteners are still under research. So we can go for natural sweeteners like dates, like jaggery, if the patient's glucose level is okay, and we can give them a little bit of sweetness, we can go for natural sweetness. So whole grains and fiber, it should be recommended, and this is very important while planning our diet. The whole grains and the fiber, it will help in the slow release of the glucose to the bloodstream, and it will help in the control of the blood sugar. Now for the dietary fats, we need to increase the omega-3 from the fatty fish or plant sources like nuts, walnuts, all those things we can include in the diet. And saturated fat should be less than the 10% of the total calories. And trans fat should be avoided, minimized, but better avoided. The cholesterol should be less than 300 milligrams daily. That is mainly from animal sources, because plant sources, they do not have cholesterol. The protein, it can be similar to general population, like for a normal person, how we are recommending like 1 gram per body weight or 0.8, preferably 0.8 grams per kg body weight is the normal recommendation. Unless and until the patient has some kidney dysfunction or nephropathy, we need to take care of the protein content of the patient, but otherwise we can give them a normal protein. Now for the micronutrients, same recommendation as the general population, because we need to give them lots of vitamins, minerals in their food, so that it contains lots of antioxidants, phytonutrients, which is also immune boosting, which helps the immune system stable. The supplements, there are a wide variety of supplements for vitamins and minerals available in the market, and many people, they think that like, okay, we can go for the supplements, no need to take fruits and vegetables, but that is not the case. You need to take natural foods, and supplements are only upon the recommendation of the doctor or if unavoidable. So we need to be active and eat healthy every day to prevent all these diseases, especially during this COVID situation. We need to try to be active indoors also. Even if we are not able to go outdoors, we can practice indoor exercises like stretching exercises or walking around our house or in the room or wherever possible. We can do stretch exercises or like yoga. Indoor exercises, there are lots of options, so we should always recommend for patients, and even ourselves we need to practice the same and eat a healthy diet every day. So now for how exactly the glucose is being affected inside the body, and how the intake and the glucose and insulin, how is the functioning. So our main organs responsible for this is like pancreas and liver. So when we take the food inside, the insulin is secreted and it is converted to glucose and gone to the liver. And if in case the blood sugar comes down in the blood, automatically glucagon is secreted and the level is maintained. So this is the normal homeostasis of the blood sugar in our body. Okay, so the insulin, glucagon, all these are the main hormones responsible for our glucose homeostasis in our body. So now we need to plan ahead for the meal plan, like for the, especially during COVID situation, we are not able to go out all the time. So we need to keep necessary supplies needed for at least 2 weeks. As doctor mentioned earlier, to keep the medicine stock, we also need to stock up on foods. But usually in our households, whenever we do grocery shopping, we usually stock up for few days. Like for example, for us, usually our main staple includes cereals, grains, pulses, all these. It is not like easily perishable items. So for perishable items also, like milk, vegetables, fruits, we can keep a stock. And if like in this condition, we all of us have started farming in our, even if we have a small balcony, we have started up a vegetable garden. So that is very good. Like all these are the positive effects of COVID. So we need to stock up necessary nutrient rich foods. Like it's not like you bought a lot of cornflakes or packaged foods and you have stocked up your cupboards. It's not like that. We need to stock up on nutrient dense good food. So now diabetes basic eating tips for diabetics is like reducing intake of carbs. Like when we take carbohydrates, we should take care of the quantity what we take in, and the foods that we choose. Like it should be whole grains, which provide us with complex carbohydrates. So when we are having an overabundance of carbohydrates, which like simple carbs, it makes our cells insulin resistance. So we need to take care of what kind of carbohydrates we are taking in or we are advising for the diabetic patients. And we need to include a plenty of fiber in our diet, which helps in the easy absorption and regulation of the blood sugar. At the same time, it helps in a smooth bowel movement, and that is very important for patients. Without a smooth bowel movement or a constipated condition, the health of the patient can have other like complications. So always we need to make sure that the patients have a smooth bowel. So for that, we need to include a lot of fiber and include a lot of water as well in the diet. So in our diet, mostly South Indian or Indian cuisine, we always have a protein along with the carbs. For example, our idli, dosha, all those things, like it's a combination foods with protein and carbohydrates. This is a very good combination because it allows like the blood sugar is released in a slower pace in the bloodstream, because this combination, it is a unique combination with all the amino acids. So and carbohydrates are there. So it like balances and releases the blood sugars in a slow pace to the bloodstream. And the cooking methods what we use, that's also very important. Usually we should encourage for boiling, broiling, grilling, baking, like that, like rather than going for fried stuff or oily food, we need to go for healthier cooking methods. And always we need to stick to whole foods, like rather than using a lot of refined foods, which is very easily available nowadays in the market. We need to choose whole foods, like unprocessed grains, like whole brown rice, whole wheat flour, millets. There are such a lot of variety that God has given us. So we need to enjoy all those things and make our body healthy. Even for the patients, when we are recommending the diet, we need to always recommend them to choose whole foods. And for the oils, healthy oils we can use. As we are from Kerala, coconut oil is the best oil that we can use. There are many like controversies that coconut oil is not good for health, like that. But in moderation, we can use coconut oil. It's a very good option. It's a healthy oil. Nowadays, even international researchers are coming back to our traditional food habits, like coconut oil, turmeric. All these things can be used in respective amounts, so that doesn't harm our body. So there are 5 amazing roles of the diabetic diet. That's very important. It's complex carbohydrates, including fruits in the diet. That is, all the diabetic patients have a doubt, like, can I have a fruit? Which fruit can I have? So diabetic patients can include fruits in their diet, provided it is taken in the necessary quantities. Maximum 2 fruits can be taken, like during the mid-time meals. meal timings, they can include a fruit. The choice of the fruit should be based upon their blood sugar control. Like if they have a normal blood sugar, they can go for the decide all fruits. But if their blood sugar level is like a bit higher, we need to choose low glycemic index fruits like apple, oranges, like that, jackfruit, mango, such fruits which are more sweeter. They need to restrict their portions. And the higher fiber foods like green vegetables, all the green vegetables like all the chira varieties that available like moringa leaves, the amaranth leaves, all curry leaves, coriander leaves, pudina, all kinds of green leaves can be included in our diet. And high fiber foods, like mainly in our place, there are a lot of high fiber foods available like the vazhapindi, vazhakumbu, the banana stem, the banana flower, all these can be included, which are very good for glycemic control. And also good fats. In our place now, maybe the availability of fish good, will be less, but including a small fish can be good. And plant sources, there is even more wide variety of plant sources like nuts. We can include a handful of nuts every day, which provides for the good fat. Now this is a sample diabetic diet chart, like giving the which all items we can include in the diet and like nutrient distribution. This is showing approximately 1600 calorie diet. So from breakfast to dinner, we can evenly space the food items. It should be like very healthy, wholesome, nourishing, like for diabetic patients, like somebody asked before, like a very strict diet, how can they follow? And if they like go away from the diet, can they still achieve glycemic control? So we need to plan the diet accordingly. Like we should not restrict, or we should not make the patient feel like they are deprived of good food. They should be given good food, but provided it should be planned well and all the nutrients should be there, provided they should not have a higher, like they should have a normal glycemic control. So here the breakfast, the timing is very important. They need to take meals on time, or even if they are not able to take it on time, at least they should not have a very long gap between their meals. So breakfast, midtime snacks, lunch, evening snack, dinner, all these things, as in the picture, we should choose healthy foods. Like it doesn't mean that the doctor has told me to eat small frequent meals, so we are always munching on something, chips, biscuit, or whatever is available. But we need to include healthy foods which are good for our body and our health condition. So we need to plan accordingly. Like in this picture, you can see it's idli for breakfast and sprouts for snack, fish curry with rice for lunch. Evening snack, you can include fruits, but not the quantity of jackfruit which is shown in this picture. It is a little more. You should not be recommending this much quantity, but that when you counsel the patient, you should be giving them the right quantity. And evening, you can include a whole grain meal with lots of vegetables. So the nutrient composition of this diet also is shown, like fat, calcium, sodium, iron, all the minerals, vitamins, everything should be there in the meal. So all days, like bright colored vegetables, lots of wholesome food is available. So we need to keep half of our plate should be vegetables and fruits. Only 1/4 we have to include whole grains, and then proteins also, nutrient dense meals. So when we choose each proteins or whole grains or vegetables or fruit, we should be choosing wisely, like whole grains. Proteins also, like not like red meat is not recommended, shellfishes. All these things should be restricted quantities. And also, since the patients may be on many medications, while planning the meals, we need to take care like certain foods which have interaction with the medicines. For example, if the patient is on cardiac medication, sometimes they cannot take green vegetables like that. Sometimes on like anticoagulants, they have interaction with certain foods. So we need to take care while planning the meals. So now gestational diabetes, they often have a lot of confusion about the diet. Like they will think that they are pregnant and they have diabetes, so how can they control their diet? So they need the necessary requirements for the fetus and their body. So we need to plan accordingly. There is no need to restrict a lot for the gestational diabetic patients because they are already monitored by the doctor, and they will be providing insulin treatment if their blood sugar is very high. So we need to give them a very well balanced diet, and they need a lot of nutrients during that time. So we need to plan accordingly, including all the nutrients similar to the diabetic plate. In the desired quantities, we can give them whole grains, non-starchy vegetables, fruits, protein, lean protein, milk products, and their blood sugar should be monitored, and necessary insulin and medication. Mostly during gestational diabetes, insulin is administered by doctor to control the blood sugar. So as doctor mentioned before, for type 1 diabetic patients, they always need to take insulin. So we need to keep a track on how much carbohydrates they are taking in their diet. So we need to constantly monitor the diet for the type 1 patients, including avoiding simple carbohydrates from their diet and including complex carbohydrates. So we need to plan accordingly, like if they are on with respect to the dose of the insulin and the quantity of carbohydrates, we need to plan accordingly. So always we can include complex carbohydrates in their diet. Now for the portion sizes of the food, like we always we need to, while we are planning, we tell them 1 cup or half cup, like that. So but often people may not understand. So when we are counseling them, we can show them live quantity. Like for example, in this picture you can see like 3 ounces of meat or fish or poultry. For example, if we are telling them, okay, you can take 60 grams or 90 grams of fish for lunch. So how can you show that? We can just show your palm and you can say that this much fish you can take, or like 1 cup means this much, a handful. So all these are live measures what we can tell them to make the patients understand. So 1 teaspoon is just like our fingertip, the quantity as our fingertip. So all these are very useful measures when we are counseling patients. Like our body, it has an innate desire to heal. So each person, when we are given the adequate nutrition and the environment, we have a natural ability to heal. So always trust, and when we counsel the patient also, we need to counsel them accordingly. Like for example, in each of our human body is made up of the 5 elements of life, right? The water, fire, earth, wind, space, all these constitute our human body. So we need to take care of these elements, and when we are concerned about our health, we need to take into consideration all these things. Like for example, in our human body, how are these related? Like our body fluids, blood, all these constitute the water element. The calories are the energy what we get in our body. Like our body temperature, it's always hot. Like we need to maintain the temperature, right? So that is the fire within our body. And breathing, the air in our body, the breathing what we do, that is like we cannot live without breathing, right? If we close our nose for 10 minutes, then everything will be okay. So air is the main element. So in our body spaces, air is there. Body cavities, the space in between our body cavities, it is the space element. The skin, the bones, all these constitute the earth elements. So accordingly, our body is constituted of all the like lots of minerals and elements. So the most high quantity what is there in our body, it is like water. Almost 70% of our body is constituted of water. So that is a very important constituent in our diet, or we need to take care of our water intake. So what is the function of water in our body? Like it's very important for hydration. Each and every cell will be rejuvenated, and all the functions of the cells need to be carried out once the cell is well hydrated. So it hydrates the brain cells, lubricate the skin, helps in digestion, metabolic functions, elimination of toxins, very important, provides elasticity and muscles and joints, reduce the water retention. For example, the diabetic patients, those who develop edema in their leg, or the patients who develop like complications, always they have some retention, water retention. So if the water intake is okay, then we can regulate it. And it helps in the generation of energy, oxygenates the blood and lungs, a purification of the blood, regulation of body temperature. And especially during this COVID situation, we need to take care of these things for diabetic patients as well. So we need to keep our body well hydrated. And also, like our body, it keeps on regenerating. We are what we eat. So every 28 days, our skin replaces, our liver regenerates, our bones, they repair. The body makes new cells from the food what we eat, right? So what you literally eat becomes you. So take care of what you put inside your body to have a well-nourished, very healthy body. Okay, eat fresh and live well. That's what we need to tell patients. And we need to include bright colors and rich diet, which all these contains a lot of antioxidants and phytonutrients, which helps to boost our immunity, and we can like remain aloof from such infections. When we have a healthy body, we can remain unaffected. But even if we get affected with any disease, including all these lots of wide varieties of foods in our diet and our patient's diet, we can provide improvement in the health. So what are all the points to be taken care? We need, especially during COVID-19 situation, all of us are locked down in our area. So we need to look for locally available foodstuffs. So eat local, choose seasonal foods. Seasonal foods are like, they will be full of nutrients. Like if we go for seasonal foods, it is freshly available. So it is like vibrant with health. We need to have that pranic energy, like very vibrant, healthy foodstuffs we need to choose. And we need to stay healthy, maintaining our optimal body weight. This is applicable. When I say we, it is applicable for the diabetic patients and ourselves and whoever we are counseling. And eat on the right time. The food meals should be eaten on the right time. And we should be choosing whole grains, lean proteins, healthy fats, fruits, vegetables, which are our immune boosters. Okay, and then well balanced home cooked meals. All of us, like now when we are at home, we cannot order from outside, or we cannot eat out. Like most of us now in the busy schedule, we prefer to eat outside or like order foods from outside. But now everything is like to a standstill. We cannot opt for that option. So everybody are at home now, and so well balanced home cooked meals. It is more nourishing, more nutrient dense, and it is like very healthy. We can be take care of our health. But nowadays what we are noticing is like we are preparing very tasty meals at home, and we are eating a lot and gaining weight and getting obese. So that should be avoided. Whatever food we are preparing at home, it should be like with healthy ingredients, whole foods, and eaten in moderation. Okay, so when we prepare at home, we will choose healthy ingredients. Like when we buy something from outside, we are not sure of what kind of ingredients, what salt, what oil, which water they are using. But at home, when we are cooking, we can be sure of all the pure ingredients which we are going to use for our meals and our family, so that we can take care of the health of our family as well as us. So now when we plan a diet, we need to take care of the 6 stays. Our basic Kerala diet pattern is based on this. Our traditional Kerala eating pattern is based on all these 6 stays. Like if we take our Ona Sadhya or a full course Kerala meal, all these stays will be there. like sweet taste, sour taste, pungent taste, astringent taste, bitter, salty. So all these tastes, they stimulate our enzyme production accordingly, and they provide a good digestion. A good digestion, good elimination, all these helps to maintain a healthy body. So now a lot of processed foods are available, so which are causing a great health risk for us. So preferably we need to stay aloof from all these processed foods, canned foods, packaged foods. Better to avoid them and prepare healthy food at home. So if it comes from a plant, then you can eat it. But if it is made in a plant, better to avoid. So we need to practice it as well as recommend to our patients as well. So these are the wide variety of foodstuffs that we can prepare at home, and we can also recommend to our patients, because all these very wide variety of foods are available for us, but we are restricting our diets to very minimal, like very easily available foods. But we should like delve deep into our like resource of the very rich availability of very different kinds of nutrient dense food items available in nature, like millets, ragi, whole wheat, rice. Many variety of millets are available now. We can prepare different kinds of food up with that, and vegetables. We can include, like to increase a vegetable intake, we can make stuffed rotis, stuffed chapatis. In all our preparations, we can incorporate lots of vegetables and fruits in different methods. So we need to plan all our diets accordingly, and including lots of healthy foods like nuts, salads, fruits, vegetable juices, fruit juices. All these give us a nourishing body, an immune boosted body. So we need to include all these things in our diet and our patient's diet. So while we are choosing, we also need to take care, like our body should be alkaline. Like we need to plan diets according to make our body alkaline pH. Because in an alkaline pH, there are very minimum chances of getting diabetes, getting infections. So diabetic patients are more prone to getting infections. So we need to take care of that, especially during current situation. We need to include more alkaline foods rather than going for acidic foods, because when we choose acidic food, our body becomes acidic, and in an acidic environment, it is very easy for the microorganisms to thrive and multiply. Even cancer and all diseases, they thrive in an acidic medium more. So we need to make our body more alkaline. So we need to choose foods accordingly. So while we are planning our meals, we need to include the food items which make our body alkaline. Okay, and choosing good hydration options. Like in our place, we have enough and more options to hydrate. We no need to go after bottled drinks or anything. We have our natural coconut water, our buttermilk, our flavored teas, our fruit juice, unsweetened fruit juices, and vegetable juices. We can use vegetables to juice up and drink for our snack time, or even replacing our breakfast or dinner. Vegetable juices are very good. And all these natural things, we need to go back to our traditions. Like we are forgetting all our traditional healthy eating patterns, which led to a lot of diseases. So this COVID situation has taught us a lot of lessons to going back to our traditions. And another important thing during this condition is to avoid stress, smoking, alcohol. All these things are great danger for our body and our health. So we should recommend our patients to avoid smoking and alcohol. If they cannot avoid, we need to ask them to slowly reduce and get rid of those habits. And stress also. Nowadays, work stress, a lot of stress, disease stress, COVID stress, so diabetic stress, hyperglycemia, all these are like intermingled. So we need to recommend them to relaxing things, whatever they enjoy, or we need to practice yoga, meditation, such things which are stress busters. So we need to always keep our mood in a relaxed condition so that our health remains optimal. So with that, I conclude my presentation. So we need to eat healthy, stay safe, stay happy. Any questions?
Okay, thank you, Ma. Now it's a time for interaction. If anybody have any questions, you can post in the chat box or ask.
Hope I was clear during the presentation.
Sure, Ma. Ma'am, one question.
Yes.
Is negative energy balance badly affect body function and physiology?
Negative energy. Pardon, I didn't get the question.
Is negative energy balance
Okay.
badly affect body function and physiology?
Yes, negative energy balance means like whatever we are eating and whatever is our output, the energy what we are giving out from our body and the energy what is we are taking. Negative energy balance, our intake will be less and the output will be more. So that is called the negative energy balance. Positive energy more means energy, whatever food we eat. For example, if we take a 1200 calorie diet, so our body has got 1200 calories from our food, but we are going to do some strenuous activity or like that, we are going to spend 2000 calories or 3000 calories. So our body, our body need to expend more energy. So we have taken only 1200 calories, but the rest the body needs to provide from our fat stored energy. So that will be like we will be losing weight. So that is for the if we need to lose weight, we need to go for such a diet plan and exercise. But if we are taking 1200 calorie and we are not spending that much, like if we are doing only moderate activity, either we will be having a stable energy condition, or if we do very little activity, that energy will be stored in our body. And if it is excessive energy, it will be getting stored as fat, and that will make us fat. So this negative energy balance, how it will get affected with our physiology or mental state means, if we are stressed or if we are getting overworked or if we are not eating enough for our requirements, then it will affect our physiology. Like it will go into malnutrition and things like that. So always we need to take care of our health according to our nutrient requirements. We need to eat, and we need to balance our activity accordingly.
Ma'am, one more question. What is the best way to keep energy level up while watching weight?
Okay, this is like what I mentioned. We need to keep our weight under watch, eating a very well nourishing food. So we need to be energetic throughout the day for our activities. So for that, we need to include fresh food in our diet. Like for example, as I mentioned before, each of our food has a lot of prana, a lot of energy in it. So we need to take positive pranic foods. For example, that the best example is the fresh foods like whole cereals, whole fresh vegetables, fresh fruits, lots of fresh water. So when we give our body a lots of fresh things inside, of course our body will have a positivity and we will be energetic throughout the day. So take care, like if we need to be energetic and positive throughout the day, we need to include a lot of fresh food in our diet.
One more question, ma'am. Why diabetic patient causes sudden loss in weight?
Yeah, diabetic patients cause sudden loss in weight because like before I showed in the glucose homeostasis, no? So when a patient is diagnosed to be diabetic, what does that mean? That means their blood sugar is high. So when the blood sugar is high, the liver and the pancreas, they have to work, and the glucagon, insulin cycle all goes on, right? So for some patients, it's not for all patients. For some patients who have a lower metabolic rate, they tend to lose weight because in order to balance the high blood sugar, the hormone activity like ghrelin, leptin, all these hormones are there. They work together and they release they use the fat stores and everything. So that is why we lose the weight all of a sudden for the patients who have very high blood sugar. So in order to maintain the glucose homeostasis, the body is trying to readjust itself. That is why we are losing a lot of weight.
Ma'am, one more question.
Yeah.
I heard about a tablet that will keep our BMR high, so it is helpful to reduce weight. That tablet is an extract of an African berry. Is it true?
Yeah, there are many herbal extracts available, but all those are not like their effect is not like a permanent. Like we are not recommending such things, because all these things are all such extracts are, some of the natural extracts are effective to keep up our metabolism and to keep our weight away. But regular intake of such supplements should be under strict medical supervision. Like just like if we found an ad or any program like that, without consulting a doctor or a dietitian, you should never take such supplements.
Okay, ma'am. I think questions are over.
Okay. So these are my references. So all of you stay home, stay safe. Thank you.
Okay, thank you so much. Thank you, ma'am. The session was very informative and interesting, and you provided a very outstanding session on the dietary considerations of diabetes during COVID-19. Thank you so much, ma'am, for your, sharing your precious time with us.
Thank you so much. Thank you so much. Hope all the students have benefited from my presentation, and I really thank all the staff and all the coordinators, sisters, respected sisters, because I am also a convent educated girl. So when I saw you, I am remembering my olden days. So thank you so much. It was a very good session for me also. I'm immensely thankful for all of you for giving me a chance to present this in front of you.
Okay, thank you, ma'am. Thank you. There is an announcement. The feedback form link is posted in the chat box. Participants, please fill the feedback form to receive the certificate. Now I invite Dr. Sister Jessie Verghese, Assistant Professor at Department of Home Science, for the vote of thanks.
Saying thanks is something we are inspired to say to someone who has touched us with their knowledge and sharing, kindness and thoughtfulness and generosity. A very warm good afternoon to one and all present here. Honorable resource persons, Dr. Nasir Ali and Ms. Ashwati Biju, respected Principal Dr. Rausepichan KV, Nirmalagiri College, Kuthuparamba, and IQSC Coordinator Dr. Sabu Sebastian, Nirmalagiri College, our most valued invited guests and participants. It's my privilege to have been asked to propose a vote of thanks on this occasion. I, on behalf of the Department of Home Science and IQSC Nirmalagiri College, Kuthuparamba, let me extend a very hearty vote of thanks to all speakers for gracing your important knowledge, time and opinions which you shared with us. A heartfelt thanks to Dr. Nasir Ali, Senior Consultant Endocrinologist, Mitra Hospital, Calicut, for your efforts towards today's topic, diabetic complications and its preventive measures concerning with COVID-19. We are all enlightened by your great presentation. Thanking you, sir. Further, we are grateful to Ms. Ashwati Biju, dietitian, the Cuban Hospital, Qatar, for giving an excellent coverage on this dietary, recommendations during this pandemic time. Thanking you, madam, for your great presentation. I may like to express our sincere thanks to our beloved principal, Dr. Avse Pichan KV, Nirmalagiri College, Kuthuparamba, for providing the inaugural address and all the encouragement and support for this international webinar. I would like to extend our thanks to Dr. Sabu Sebastian, IQAC Coordinator, Nirmalagiri College, for timely support. I extend our gratitude to Mr. Manu KM, Assistant Professor in the Department of Economics, Nirmalagiri College, for his technical assistance and all timely help. And I may extend our heartfelt thanks to Mr. Roshan Thomas, Assistant Professor in the Department of Commerce, Nirmalagiri College, for the technical assistance for YouTube live streaming. I sincerely appreciate all the participants of this webinar who makes this event fruitful one. Thanking you for your attention, patience, and interest towards the webinar. Well, dear ones, as we know, an event like this cannot happen overnight. The wheels must be started months ago. It requires planning and a bird's eye for details. We have been fortunate enough to be backed up by a team of very motivated and dedicated colleagues in Nirmalagiri College. Last but not least, I sincerely congratulate and thanking you, Dr. Sister Celine Matthew C., Head Department and Assistant Professor, Department of Home Science, Nirmalagiri College, and Mrs. Deepthi Elizabeth K., Assistant Professor of the same, for your hard work and coordination, which make this event a successful one. Once again, I am expressing my sincere thanks to everyone gathered in this platform. Thank you, and may God bless you.
Thank you, sister. Second sister.
Okay.
Wind up, sister.
Right.
Once again, I thank you for Ms. Ashwati and Dr. Nasir Ali.